My name is Tim Reha, host of Digital Health Live here in beautiful San Francisco, sunny day. We have Mark Schwartz, who's with a really cool group called Launchpad Digital Health.
Well, thank you, Tim. It's great to be here.
So you got the managing director title, so that means you run things. And so the panel was basically called The Debate, what does it take to avoid the funding valley of death? So what is the funding valley of death?
Well, first of all, there are 3 partners in our fund, and to date we've invested in 11 companies exclusively within digital health. We attempt to broadly define digital health so that we can capture as many different companies as possible to consider them for investment in our strategy. In terms of the topic today and funding the valley of death, so to speak, really what we're attempting to do is this is a relatively new space, and there are many new investor participants in the space. And they all want to understand where this ecosystem is headed. And should they be investing in wearables, or should they be investing in enterprise-facing software, or should they be investing in something that's more consumer-facing? And so given that there are a number of different ways to look at the space, and a number of different opportunities and sub-segments within digital health or mobile health, it can be a bit confusing. And as an investor who is new to the space, oftentimes they'll look to a firm like us that invests exclusively in this area to help guide them.
Okay. And where do you source deal flow from? It's a wide area. You have companies in Israel and all over.
Well, we do cast a wide net. I would say we cast a net internationally. We have invested in a company, as you mentioned, from Israel. Their executive team is moving to our offices in San Francisco. We invested last year in a company from Belgium, and they've moved their executive team here to San Francisco and are growing their company here in San Francisco. What each of these companies have found, whether they are international or they even starting locally, is San Francisco has become somewhat of the epicenter of digital health. And these companies, when they move here and co-locate with us at our space here in the city, they very quickly learn that they can accelerate their business much faster than they could being overseas or in the Midwest or wherever they were previously. And that's because they can pick up the phone and walk around the corner or drive 15 minutes and see most of the customers and businesses they want to talk with.
So Mark, what is different between a typical, say, tech startup doing cloud or mobile and digital health, and how's their chasm different?
Well, the way we look at it as an investor, we don't exclude medical device or wearables, but we haven't invested in any to date. We look for companies that are simply building software and providing software and services to their customers, whether those customers be insurance companies, hospital groups, other care providers, patients, so across the value chain within healthcare. And we look at software particularly for a number of reasons. One, depending upon what the company is off to do, oftentimes there is no FDA approvals that are required.
Yeah, that's big.
And the fact that there is less regulation leads to a bit more certainty for the investor in terms of timing for outcomes. Also, given software as opposed to a hardware company, oftentimes the initial capital investment is considerably less. So as an example, today one of our portfolio companies, Sensely, which is a virtual nurse avatar based on artificial intelligence and machine learning, they raised a Series A that they announced today. Now, their Series A was not $5 million or $10 million as is becoming customary in the Valley. It was a little over $2 million, and the reason it was is because they're a pure software company. They don't need the additional capital required to build out a hardware platform or go through a regulatory regime. Additionally, they've got significant revenue in their pipeline, and that is also reducing the funds that they needed to raise.
Nice work. So that's congratulations on the funding. So Mark, how do people get a hold of you and the Launchpad, and what's the best approach?
Well, they can email our fund at info@launchpdh.com, or they can email me at mark@launchpaddigitalhealth.
Great. So thanks for being on the show and being part of the panel.
Thank you. I really appreciated your time.